the Istanbul International Center for Private Sector in Development. There's big name here. We are the global hub for UNDP on programmatic and policy and program support in the areas of private sector in development. The center is a partnership between UNDP and the government of Turkey. We are very thankful for that partnership in that sense. This session is entitled The SDGs in the Private Sector, How Companies are Measuring their Contributions to Development. We might be a little bit different than the other panels in the sense that we actually don't have an evaluator in this panel at all. So hopefully you will enjoy the perspective of two companies, an academician and my colleague from the Business Call to Action. And the Business Call to Action is an alliance whose secretariat is hosted by our team at the Istanbul Center. And it has several donors to it, and it has more than 200 companies that have made commitments, business commitments, core business commitments to be commercial viable, while at the same time integrating the base of the pyramid, that half of the world's population that lives with $10 a day or less, into the core business, either as suppliers, distributors, or consumers. And we have two of those companies here in that sense. And so the panel, we have Prateek Ahuja, Regional Manager of Medtronic from India. We have Asha Hassan, Founder and CEO of Naya Javan. They're going to introduce themselves and talk a little bit about themselves later on. Ms. Gonja Ongan, Managing Director of the Kochi University Social Impact Forum. And my colleague Tomohiro Nagasaki, Impact Team Leader on the Business Call to Action. Before I turn up to Tomo, which is the only one that has some slides, and so is we are gonna, each one of them are gonna have about 6 minutes to introduce themselves and talk about the value of impact measurement and their work around impact measurement. And then if we have good questions from you and questions from you, we're gonna go into questions. If not, I have my own questions that at some point I'm bringing until you all warm up and want to engage. There will be microphones running around the room. So, as you all know, all the members of the United Nations have approved the Agenda 2030, people, planet, and partnerships. And an important element of the Agenda 2030 is how do we know, right, that in this whole conference, how do we know that we are making progress on Agenda 2030? And how do we provide the evidence throughout the next 13 years that allow us to course correct in that aspect? Now, we also know that the price tag of Agenda 2030 is extremely high. Now, anything between $5 to $7 trillion it could cost globally the agenda to develop and implement the SDGs. In that sense, what is obviously is the SDGs cannot and will not be successfully implemented and achieved without the private sector. And it's not just because of the resources, right? But it's also because of the innovation, the dynamism, the technology, the methods by which the private sector work. Let's not forget that 90% of all jobs in developing countries are created by the private sector. 60% of all capitals in the hand of the private sector. So those are just a few statistics that demonstrated how essential to the SDGs business is. Now, the nature of business has also to change. The business models are going to have to adapt it. In the last 20 years, business has related back to development primarily through corporate social responsibility or through charitable means. While those are still going to exist, we have to build upon them and move beyond that. You know, the only way the business not only are going to contribute it, but maximize that contribution is through the core business operations. So we have to find a way by which business are able to be profitable, social inclusive, and environmentally sound at the same time. The good news is the business community is aware of the SDG. The business community sees the SDGs as a business opportunity. As a matter of fact, there is a report that was put forward by the Business Sustainable Development Commission called Better Business, Better World, that has quantified the economic opportunity inside of the SDGs for the companies like the ones here that internalize the SDGs in their business is $12 trillion over the next 13 years. So that's not small change. $12 trillion with T of business opportunities inside of the SDGs. Now, back to why impact measurement is important is, if business are going to play this role in the eye, so essential, how do we know the business is accomplishing the social goal that they say they are? How do we have that evidence that can allow us to have conversations with government officials about what kind of business models you as regulators will be able to point the market towards? If we have the evidence, can we ask, like for example, in the Philippines, for a tax incentive to be put forward for the business that are deliberately, systematically achieving a social goal, as well as profitability, you know? Now, to influence policy, we need the evidence. And where is this evidence going to come from? Our hypothesis, and the work on the business call to action that Tom is going to briefly present it to you, is that for this to happen, it has to be integrated in the operations of business. It has to be integrated into the dashboard of business. Business don't necessarily like to have processes that run in parallel. So however they are running their business, whatever they are monitoring, whatever they are evaluating in the normal course of profitability, how do we embed impact measurement in that? And more important, how the data collected by business is essential to improve business processes, while at the same time telling themselves and us outside business how that impacts and how that's contribute to the SDGs. Can that data be linked to the government statistics data on SDG progress? Can that data become part of the voluntary national reports to the high-level political forum? Those are questions that we explore, you know, in our team together with the Global Reporting Institutes, but have not yet been completely answered. Now, and I will shut up after this. The potential is there, the opportunity is there. We need it. Companies are already doing, as you're gonna hear. But let's be honest, not everything is rosy. There are barriers for business to include impact investment, impact measurement inside the corporations. You know, there's a lack of common impact standards. There is a cost. Who bears that cost? And there is a perceived criticism that the use of lean data methodologies allows companies to choose what is easy for them to measure or what they want to measure, rather than necessarily what they should measure vis-a-vis the SDGs. So those are the discussions and those are the issues, not only the experiences, but the challenges that we are going to tackle in the next hour and a half, hopefully with your engagement throughout the process in that sense. So without further ado, let me hand it over to my colleague Tomo, who will present the approach that the business call to action has put forward. Then we have two companies that are members of business call to action, have gone through this approach, who can describe to you how they are doing and why it matters to them. And then we'll come to a wonderful partner university here in Istanbul in Turkey, the Koç University in that sense. Tomo, the floor is yours.
Hi, my name is Tomo Nagasaki. I work for a business call to action on impact measurement of our companies. I'd like to start my short presentation by introducing ourselves. Business Call to Action, BCTA, is a global platform of inclusive business models. And we aim to accelerate progress towards the SDGs by challenging companies to develop inclusive business models. And by inclusive business models, we mean businesses that contribute to the benefits of people living at the base of the pyramid through their core business, as consumers of their services and products, or as partners in their value chains as producers, suppliers, distributors, and employees. As of today, we have over 200 companies on our platform, and our companies range from small companies to large national companies to multinationals, and they work in a variety of sectors, including health, agriculture, energy, and so on. Our companies are based across the globe, nearly in 70 countries, and our estimate of the collective impact of our companies is that they've reached 200 million people through their core business. So as Marcus had already elaborated, SDGs, as I think all of us here in this room agree, is not just of the responsibility of the government, but they call to action for actors in a variety of sectors, including the private sectors, and we're seeing a lot of involvement and excitement from the business communities to engage with SDGs. A lot of the companies are using SDGs as a framework to define their new business models and develop product and service lines to benefit along the 17 goals. So while we have these increasing number of companies that are aligning themselves to the goals, there are equally increasing number of people and entities that are interested in measuring how these companies are actually benefiting along the 17 areas. And these are businesses who operate these initiatives themselves, but also investors who invest in these social enterprises, companies with the aim of providing social and environmental benefits, and also governments. We see governments who are increasingly interested in understanding the types of business models that have concrete benefits to people living at the base of the pyramid and other vulnerable groups. So there is a need, the SDGs has really increased the needs, the demand for the data that is available to understand how businesses are impacting along these goals. And at BCTA, we've been working with a select number of companies, 21, including our colleagues here from Niajivan and Medtronic, to work on impact measurement of their businesses. And in the screen, you see the companies that are our partners, and we've worked with companies in South Asia, Africa, and Latin America in different sectors for different reasons. And I'd like to kind of just explain first the process that we've gone through. And the reason why we started this is to, is having this SDGs in mind, how as BCTA could support companies in getting those data. And this is the process that we have been implementing with these companies. So first is recognizing the fact that there are so many tools already available on monitoring the business performance, and also a variety of needs on the company side. We saw there's a need to match the companies with the applicable tools that best benefit their needs. And from our experience, we have seen that not all companies are suited to implement a certain kind of an evaluation tool because of the capacity that is required, or the time that is required, or the resources that is required for the companies to invest in. Because we work with companies with, ranging from big companies to small companies who only have little resources available to dedicate to this exercise, we saw the need to really understand what the companies want and then the tools that best match them. So that is the readiness assessment that we first conduct. And then the second process is really planning and design of the impact framework. And we borrow a lot from the development practitioners' theory of change approach, but we tweak it so that the business communities can understand the language. So rather than talking a lot about the theoretical approach, we try to make it very practical and indicators to be quantifiable so that the companies could use it for their business making decisions. Once we help companies develop the impact measurement framework with the indicators, we then help companies to implement the data collection itself, and we do this using a mobile-based survey services. So the companies use mobile phones with an application that allows them to collect data directly from their beneficiaries or clients for data collection purposes. And lastly, we then help companies to do an analysis of the data that they collected so that they could use the data for making better business decisions, which we hope will help their business grow and thus providing more impact to the clients that they're serving.
First of all, thank you to UNDP and especially to the Business Call to Action team, Marco, Paula, Tomo and Yunzong for your incredible hospitality. I love coming to Istanbul. It's such a magnificent city. So when I was invited, I was like, yes, I'm definitely coming here, even if it's only for a single day. So thank you again. It's always fun speaking right after lunch. And I was hoping that you wouldn't pick on me first because my blood has mostly rushed down here and there's very little left up here. But that actually might help me in sharing some of the concepts or thoughts that I have. So first of all, just to kind of give you a quick intro to Naya Jivan. Naya Jivan means new life in Sanskrit, Hindi, and Urdu, which are the languages of India and Pakistan respectively. And just to kind of give you a sense of what we do first before I get into our theory of change and how we measure some of the impact that we are aspiring to make. So what we do is we partner with large corporations, multinational companies such as Unilever, P&G, Reckitt Benckiser, etc. We identify low-income stakeholders in their value chains, low-income workers such as, for example, smallholder dairy farmers providing milk into as an input into dairy companies, or small, medium enterprises that are selling stuff, retailing goods on behalf of a fast-moving consumer good company like Unilever, or informal domestic workers, maids, drivers, cooks, gardeners, guards, who happen to be working in the homes of a Coca-Cola manager or executive, for example. And we take these low-income populations, we aggregate them into a single risk pool. Then we go and engage with insurance companies such as Allianz, Jubilee, etc. We negotiate the best possible plan on their behalf. Most of these plans in Pakistan, which is the country we have scaled in, are hospital-based plans. And so the health insurance side takes care of the hospital side of the equation. But we realized that most of our beneficiaries actually need good quality care where they work or where they live, and that care has to be delivered through primary care physicians or community health workers. And so we provide that healthcare delivery directly. So we do both service delivery as well as health financing. It's kind of like Kaiser Permanente in the US, if I can use a similar model analogy. Our theory of change, just before I get on, the companies that we work with co-finance this plan or these health and wellness plans as part of either supplier quality control, retailer incentive, or the third thing is market expansion or customer loyalty programs. And so they have a triple bottom line objective, which is that they not only want to make money, but they also want to impact, socially benefit the communities that they're working in, as well as reduce their carbon footprint, improve the environment. And so that's the overarching objective of the corporate partners that we work with. Our theory of change, or theory of social change, is that by giving these low-income communities access to health insurance, health and wellness, but specifically health insurance, which is a form of asset protection, that we will over time enable them to emerge out of poverty. So one of the concepts or themes is that in order for any community to emerge out of poverty, there are two things which are essential. One, income generation ability, and number two, asset protection of those income generating assets. And we believe that the most important income generating asset is the human body. And therefore, our focus is on health insurance and health care in general. Now, some of the concepts that are associated with this are in terms of how do we, what impacts are we trying to achieve and how do we measure those impacts? As you can probably imagine, in the area or arena of healthcare, a lot of the outcomes that happen, such as, for example, reduction in child mortality, child death, or reduction in maternal mortality, happen over many, many, many years. And it requires very, very large sample sizes, which oftentimes are not practical from a business or social impact perspective to measure over that length of time. And the reason is that most of the time, our donor timelines or our investor timelines are not 10 years. They don't have a 10-year horizon. They might have a 3-year horizon. And in order for us to demonstrate the impact of our intervention in those 3 years, we need to use other forms of indicators, outcomes that can indicate or suggest that we can reduce mortality or morbidity over time. So some of the indicators we use are what we call proxy indicators or surrogate indicators. And I'll just give you an example of that. So we deal in a country where diabetes is a major issue. Diabetes and obesity, both actually. And in that context, while we know that diabetes, and there's a lot of evidence, scientific, rigorous evidence that indicates that diabetes is associated with mortality, with heart disease and mortality, our way of measuring impact on treating diabetes or preventing diabetes is by measuring a biological indicator which we call hemoglobin A1C, HbA1c, which the literature shows is a good way of tracking over time the impact of your intervention in diabetes management. Now, for us, it's practical from a business perspective to measure that indicator. It's easier to measure that indicator, and it enables us to actually do a variety of studies, which I can get into later on. But I'm just giving you an example of an intermediate indicator that we use, which is obviously not the ultimate indicator that we could use, but it's something that we do for reasons of expediency as well as that it's practical.
Shruti is a very different sort of a model for even Medtronic to work on. So we essentially started it as a pilot in late 2013, and we started working on the problem. So the problem was there are a lot of people who essentially do not have access to proper ear care. They don't know where to go to. Affordability was also an issue. So access, awareness, and affordability. And that's where we focused, all our energies on. So we picked up those issues, and then we started looking for a solution. So the solution was, and one of the biggest problem in the India subcontinent, actually more so for India, is there are a very limited ENT surgeons around. So how do you take all these, all the affected population, screen them, diagnose them, and then also give them the apt treatment? One of the solutions was to take the care at their doorstep. Now, that's where we started building the model. What we realized that essentially, even though it was just an idea and it started as a pilot, we were able to sort of convert it into a business model. And it essentially became a business model innovation program for us in Medtronic. We created a smart, portable, networked otoscope, which people could use at the doorstep, and they could take pictures of the eardrum and could create the whole patient case, and then upload all of that information along with the pictures onto a cloud server, which was then accessible by the ENT surgeon who's sitting in his clinic or the hospital. That sort of was the solution, but we then built around a lot of services, which means a lot of behavior change, counseling services, which these community health workers were trained on. And that is where the program began. From a small pilot in India and in Bangladesh, in Dhaka, it is now a commercial business for us. But I think where the need of impact evaluation started was that we really need to, I mean, we wanted to figure out whatever we are doing, is it making any impact on the communities we are trying to serve? How does it change their lives, right? Hearing is a big problem. A big chunk of Indian population and also Bangladesh population, they are affected, and it affects their work. It affects children going to the school. It affects their performance in the school. It affects, so a lot of people actually lose their jobs because of this. And we thought this is something that we need to hold on to, and we started evaluating it along with BCTA. And in the last couple of years, I think there were certain assumptions that we started with, which is, you know, there's a lack of problem, and this is the way we are going to be solving it. But over a period of time, we've been able to find out, I mean, these are some of the questions we wanted to answer. Are we targeting the right sort of communities? If we screen these people, will they be able to, even if we subsidize the treatment, the care, will they be able to you know, make use of that ear care pathway that we are creating for them? How is it going to improve their lives in the long run? Is it going to help them you know, increase their quality of life? So we had a whole lot of these questions, and how can we sort of do all of this in a very sustainable manner, which sort of makes it a social business and not just a social program for us. So these were the questions that we were looking, you know, we were looking for answers to these questions, and I think over a period of time we've been able to find a lot of these answers. And then what we essentially do is whatever the answer is, it helps us evolve the model further. We add a lot many services to the program, and it essentially is a tool for us to be able to replicate the model and also expand the model in different geographies. So now we are expanding commercially all over India, and also we've started looking at other avenues. Thank you.
Yes, my name is Gonca, and I'm the Managing Director of Koç University Social Impact Forum. And we are actually a very unique model in Turkey. And I have been in the social impact sector, I would say, since 2004 in Istanbul. So I used to do my own business, and then I started to work with the mayor of main municipality in Istanbul, in Beyoğlu. And then I started to work with construction material producers in Turkey, very big lobby group, industry people. And then for the last 6 years, I am at the university. So I'm kind of a like boundary spanner, and I have empathy of all the stakeholders that I'm serving and supporting them right now. I can understand what they think, what they get benefit from something. So, and working in a university, when we were starting Social Impact Forum, why Social Impact Forum? At that time, we were established in November 2012, and we did a need analysis for 4 months in Turkey. What kind of center we should open that social impact actors could benefit. At that time, there were a lot of social entrepreneurship center and social innovation center, and we saw that all the actors that claiming that they are creating social impact, but they are not doing any impact measurement. So we thought that as a reliable research university, if we open such a center, such a forum, supporting them, increasing their capacity on social impact measurement and management, so it would be very useful for them. So that's how it started, Social Impact Forum. And mainly we do 2 things. First of all, we are a university, so we educate young people. One thing that KUSIP does is develop new curriculum for students. Like we are doing a course, Social Impact Creation and Project Management, where we work with, companies, responsible companies, social enterprises, NGOs in Turkey, and we transfer our knowledge in the field and our network in the field to the students. And we integrate, we try to integrate sustainability issues, social impact issues into the main curriculum and develop, other kind of programs for young people. On the other hand, we work with social impact actors. I mean with impact actors is like responsible companies, social enterprises, funders, mainly funders in Turkey. We work a lot with them. And of course, NGOs. And we see that in order that, they increase their capacity on social impact measurement and management, we need to develop their knowledge, develop their skills, and also increase their knowledge on how to do impact management, impact measurement and its management. So we are a kind of a practice and resource center for these guys in Turkey, and we do a lot coaching, consultancy, mainly free consultancy we do. Very few fee-based consultancy because we don't have time, and we are very focused on building the capacity as a whole sector. So we develop, I think, the most important thing that we do in Turkey is to develop resources in Turkish, because the impact measurement area can become very confusing for mainstream people. I mean, mainstream organizations, grassroots organization. I mean, in Turkey, all of my colleagues are very focused now, speakers specifically on private sector, but we work with all stakeholders in Turkey. And actually, I mean, the most important area that we are focusing is not the how to measure, but what to measure. Because before, without doing the planning and knowing what to measure, you cannot measure it. So this is the strategic part that people are struggling most. So from the grassroots organization to the very big organizations, we do support them strategize their theory of change, their outcome mapping, how they will involve their stakeholders. So when we develop their support them outcomes and indicators, so they can very easily work with an expert researcher to measure. And then we also support them how they're going to manage their social impact. This is how we are concentrating exclusive. Actually, we are not offering them a specific model, but mostly we try to support them to integrate these social value principles into their work. Which are they? Value the things that matter, be transparent, understand what changes, involve stakeholders, only include what is material, verify the result, and do not overclaim. Believe me or not, but I know social enterprises saying that, I have 360-degree social impact. So I was like, so new terminology to our literature. So we are trying to support these people to really integrate social impact into their business model. Yeah, thank you.
Thank you. Asha, you were talking earlier about the value of, and you were giving an example. Now, can you tell us a little bit of, in this journey that you've been in, what was the time that you actually got data, and how did you use that data to actually improve the service delivery of the business, right? If you can give an example. And then, what is the challenges, right, that you have it to grow impact measurement, including how is financially sustainable to a company to pay for that? And perhaps the third element is, what is the role you see between a company like yours and the public sector in terms of kind of coming together and sharing data and, and supporting a larger ecosystem on this?
Great questions. I hope I can remember all three of them. I'm probably going to ask you to
I'll
remind
remind
me. Okay, so the first question. So first of all, we, as I mentioned earlier, we offer a health and wellness or health insurance plan to low-income workers in corporate value chains. Again, suppliers, retailers, domestic workers that are affiliated with corporations, etc., financed by or co-financed by these corporations as part of market-based loyalty, incentive, or quality control programs. Now, as part of our intervention, as part of our philosophy, I should say, of Kaizen, which Tomo will know means continuous improvement, the idea there is that the benefit design that we offer, the features of our health and wellness program are constantly improving and address the needs of the population that we are serving. And so we have created over time continuous feedback loops that are constantly engaging our beneficiaries. And we have, to make it more concrete, we have a call center that both takes incoming calls from our beneficiaries or customers to address any questions that they may have regarding their insurance benefit design or the features that they may have access to. But it also makes outgoing calls to actually engage those the same beneficiaries, the same customers, about various aspects or features of their of the benefit design to see. And over time, we have moved or evolved towards a more human-centered design thinking process, meaning that moving towards a model where we are continuously iterating, introducing new features into our model or into our program, and as part of our own research and development, R&D, we then ask or survey our customers in real time what they think about those new iterations, and we obviously do that in small samples or small target markets. So we will typically, for example, introduce a new feature in a target population in a single city as a pilot before we roll that out nationwide commercially. And I'll give you a specific example of that recently, and in fact where we used a tool that was very kindly provided to us by UNDP Business Call to Action. I'll explain what that was. So our health insurance plan, as I mentioned, is mostly hospital-based, but our customers for a very long time, members, had been telling us that what they really needed was access to good quality care where they live or close to where they work, which is where they spend most of their time. These are factory workers, these are workers in the field, these are farmers, and they essentially did not want to have to travel far distances or commute to access care. They wanted it close to where they work or where they live. And this was just qualitative feedback that we had been receiving over time. So we said, okay, let's actually study this slightly more rigorously, and let's set up an experiment, and then maybe if we can achieve proof of concept of that, then we will scale and then actually do a much more rigorous RCT, randomized controlled trial, to actually much more scientifically, rigorously evaluate this. So what we did is we added on a primary care benefit in which now our members have 24/7, 24-hour, 7-day access to a network of female doctors who work from home, who provide services to these members through video consultation, through telemedicine. And so we are using technology, and we are training nurses or community health workers and placing them inside factories, inside corporate offices, inside retail clinics, inside community centers, basically where our members live or work. And the idea there was that those nurses who have been trained on how to use technology and how to use tablets can now connect those members through technology to these female doctors. As an aside, since we're talking about SDGs, the community health workers that we are working with were trained by the government but were relatively underemployed. They had been part of a government training program which had been rolled out nationwide in which they were training lady health workers, community health workers, but this program had faltered due to political issues, and over 100,000 of these community health workers that had been trained in Pakistan were now either relatively unemployed or underemployed, not being used to their full capacity. So we said, let's re-engage them, let's reintegrate them into the workforce on the patient side, close to where, again, our members live and work. And let's also, at the same time, reintegrate those women doctors that we know are not present or not participating in the workforce, either because they're caring for parents or children, raising families, which is true across the world, or in the case of Pakistan, they have a unique phenomenon where a significant number of female doctors are excluded from the workforce, largely due to social cultural barriers that discourage them from working in the public space, which is more specific to Pakistan or to that region and not necessarily a global phenomenon, but certainly the exclusion or non-participation of women in the workforce is certainly a global phenomenon. And the idea of creating more agile workforce is something that we are moving towards. And so as part of our social mission, we said, we want to create value for our end members. We also want to create value for society. We also want to address SDG 5, gender inclusion and gender empowerment. So let's try and do all of this simultaneously. So we reintegrated female doctors, we reintegrated community health workers, we connected them via technology, and now that is our primary care healthcare delivery platform in Pakistan, and it's nationwide right now. So we wanted to study what is the impact of that intervention, of that healthcare delivery program to our existing program, and how has that impacted our end beneficiaries, our health consumers. And so we took two groups of two populations. One population was a group of individuals that were affiliated with the field force of Unilever, basically. This included the primary worker, the spouse, the children, if they were married and had kids, and their parents. Parents also included. And then we compared that group to a similar multinational, in this case Shell, which did not have that access to that program. So they both had access to health insurance, both had access to everything else was the same in terms of the benefit design. The only difference was we added on or layered on a new intervention, which was this primary healthcare program, to the Unilever population. And then we actually compared them. And we used mobile phone-based technology that was provided to us by UNDP, and we actually were trained, our team of surveyors or field-based researchers were actually trained by a tech vendor based out of Nairobi, Kenya, called EcoMobile. And we were very excited about this because this was an opportunity for us as a business to partner with both researchers as well as technology companies that actually have expertise in this type of data collection technology, which we did not previously. And so by using this mobile phone-enabled cloud-based technology, we were actually able to observe a significant difference. So we measured this statistically. I can go into the statistics if you're interested, but we actually measured the statistical significant difference in a couple of variables, including some health outcomes, including the customer feedback, qualitative, quantitative, etc., a number of different metrics that we wanted to see in terms of how these two groups compare. And the overarching or kind of the bottom line summary, if you will, was that the group that received the primary care intervention actually was significantly more engaged in terms of their own health-seeking behavior. It changed their health-seeking behavior by having a health coach or health resource that was close to where they work or where they live. And it had a significant impact on the community around them. So there was a ripple effect as well. So wherever these workers live or live especially, they shared that knowledge with some of the people living in those communities. And so it did have a ripple effect as well. Now, obviously, this needs to be further studied in a much more rigorous fashion through an RCT, etc. But the point I'm trying to make here is that it gave us enough confidence or enough evidence, if you will, or enough belief to say, okay, here's something that is actually useful and impactful, and we should actually scale this now. And so, to your point in terms of partnering with the public sector, we have actually now taken some of this evidence to to the federal government as well as a provincial government to say, hey, government, and by the way, just as an aside, the government, the public sector infrastructure in Pakistan, especially as it relates to healthcare, is dysfunctional. The government in general is dysfunctional, but specifically the healthcare infrastructure is. And so there are leaders, obviously, in the government who want to change that. And so we engaged some of these people and we said, we would like to partner with you and we would like to improve or enhance the healthcare delivery in your public healthcare system in Pakistan. And so at least some of these leaders are open-minded and said, yeah, sure, show us what you have. And we shared with them this recent study we did. And they said, there's something here. Let's see if we can use this technology in some of our primary healthcare units, in some of what they call basic health units. And maybe this is a way for us to deliver better community-based primary healthcare to the communities in which you are not present, you meaning us, because we obviously cannot reach everybody in the country. We are currently only serving 300,000 people out of a population of approximately 200 million people. And so we have just skimmed the surface, if you will, in terms of impact. So accessibility and path to scale is something that I believe can happen. It can be facilitated by organizations such as the UN. And it's something that, but I think that the catalyst to that is having this type of technology-enabled social impact assessment, which gives us companies, private sector, the opportunity to do things at sufficient scale to have enough evidence that can then be taken to the public sector for replication and scale up of that.
So my question is rather than the business model the private sector will take on that fits in achieving the SDGs. Of course, the nature of private companies, the main objective is profit maximization. Profit maximization, that means also the impacts that will be measured will be around the questions of profitability. There are some social business models. Professor Yunusha in Bangladesh has made a great job, but his main objectives have been of social solving problems, and profitability has been secondary. So really, I really understand the private sector to provide jobs, to make development. Okay, they may do the social responsibilities, but that could also be for advertising and promoting their companies. My question, which social business model are you telling us that will fit in the design of the SDGs that will be inclusive and it is not going to leave many behind? Because the nature of private company, as I know, is that of profit maximization. Thank you.
Thank you. My name is Dorothy Lux. I'm the co-chair of Eval SDGs. My question is, I'm part of the private sector, and we are trying to work in terms of transformation for the SDGs, which is not just about social impact investment of small projects. So I was really interested to hear what you were saying about taking it to scale. What do you think is the prospect of companies moving away from doing small projects which are worthwhile as part of their social corporate responsibility into mainstreaming business practices and business models which really make a transformational change?
The work we've been doing for more than a decade at UNDP in terms of the growing inclusive market as well as the notion of inclusive business, what we found out, it is that while business and a growing number of business has to be profitable, if there is no profitability, there is no business. It's charity. The way you frame was profit maximization. I actually think that the companies in today's world whose single-minded objective is profit maximization are not going to exist in 5 years. And I think most companies know that, and most investors know that. which is very important because company responds to three things: regulation, consumer behavior, and capital. That's how, this is the three things that companies care, right? So I will challenge the notion that the private sector as a general universe, it is yet in the mentality of profit maximization at all costs. Now there's a lot more that can get better. Number one point that needs to get better is the transition from a short-term quarterly reporting to Wall Street to, you know, a long-term sustainable development thinking where it's profitable is there, but you don't need to worry about what happens in a quarter. And leadership of business bonus are not tied to the quarterly performance. That is a big bottleneck that I think needs to be broken, so we can see what is already happening to become a larger mainstreaming in that sense. And that links to your point about, you know, the 200 plus companies that are in the business call to actions, not a single one of those companies, including the two here, are doing this through CSR. They're all doing this to make money. And this is why, let's be honest, right? I work for the United Nations Development Program, and I used to work for an NGO before. You know, we would die for a small pilot of 300,000 people. This is the power of the private sector, right? What Asha calls small, from a development point of view, is massive. We all would die here, from the development point of view, to be touching daily 300,000 people. And he calls that small, right? So let's, you know, that is the power, and that's why the private sector is essential, you know, in my opinion, in our research vis-a-vis the SDGs. So, Tom, go ahead, and then I want Prateek to talk about, you have one project in a very larger company. How does your project actually affects and changes the entire Medtronic, you know, and what change an entire very, very large corporation can come from one project in that sense? And perhaps back to your point, what is the average, you know, are the people benefiting from your year program? Are they poor people? Are they middle class? Are they rich people? Because that has to do with your link of, you know, health services to leave no one behind. And then Tomo after that.
Yeah. Thanks, Marcos. I think I would like to connect to what you said, three things, and consumer behavior actually is it's a big driver. And we sort of relate our impact to the consumer behavior, because if, you know, consumer behavior and what we do sort of very much reflects on the impact that we create. So we are focused, our target market is actually low income groups, lower and lower middle class communities in India. And the kind of impact that we are creating is sort of a lot of brand building for us as well, and for our ENT care pathway. So a lot of ENT surgeons, multi-speciality hospitals, private hospitals, charity hospitals. And they also, in a way, become a part of this whole, you know, model that we are creating. And just to bring it back to the, you know, to the discussion, Shruti is the only program in Medtronic which is sort of working from down below. We started working on the problem first, and then we created a solution which is sort of valid for emerging markets, starting from India. And our whole focus, when we say it's a social business, yes, it has to make business sense, but not at the cost of you know, not creating impact in the lives of that we are trying to serve. So it has to make impact, and that is, once it's making an impact, you know, it has to be sustainable. I'm not saying it has to be 200% margins. It can be very low margins, but till the time it's sustainable, it helps us churn the same money and the investments, and we reach out to many more people. So we actually, as of May 2017, we screened 300,000 people, again the same number, but 300,000 people in India and Bangladesh. This number is growing exponentially because we are adding new sites and new ENT partners on a daily basis. And this is only going to go up. So we want to reach out to millions of people, and that is only going to happen if we make it sustainable. If it doesn't make business sense, then we need to depend on a lot of grant aid and things like that. And that, to us, a company like Medtronic, it's not difficult, but for a program which is based on communities, which is based on underserved, non-premium market, it only makes sense once we are strong with the impact part of it, once we are strong with the social part of it, then we'll be able to easily take care of the social part of it because it very much relates to consumer behavior.
I just wanted to add to the question of how can companies mainstream SDGs into their operations from the measurement perspective. So we've been discussing this issue from how impact measurement as a management practice, but there's also a side to it how businesses, not just businesses, but how investors and governments can also influence businesses to adopt SDGs into their corporate practice so that they can align themselves closer to the SDGs. And BCTA, we did a study with the Global Reporting Initiative last year, which is a global sustainability standards on environmental performance. And we've conducted interviews to companies, CEOs, and also relevant government stakeholders. And a lot of the companies are facing a lot of regulatory pressures from stock exchanges and their national governments to report on their social and environmental performance. So these are things that can also influence, and it is already influencing a lot of companies' behaviors to be more in line with a social and environmentally friendly manner. So impact measurement that we are discussing here is as a management tool to assess how impact could be enhanced through their operations. But there's also another set of actors out there who are trying to inform industry from a regulatory and a legal perspectives. So I think there's a different ways to do it.
Yes, I would like to respond to the CSR companies doing CSR question. Actually, of course, we support companies being more inclusive, and develop their inclusive models, new business lines, inclusive business lines. But we don't expect them to become social enterprises, or instead of doing, they can still do CSR projects. It's very valuable. We also discuss with our colleagues among us this, the CSR approach transformation. But we value most the collaboration between social enterprises and companies. This is very valuable, I think, for collective impact. And also I see that, for instance, in Turkey, CSR approach is very powerful and strong. For the last couple of years, some big companies, still they keep doing their CSR projects, but they started funding social enterprises. They started to develop some funding capital for social enterprises. They support them, and then they give them like $20,000 or euro if they are successful. So it's very valuable as well.
So the average income of our beneficiaries is about $10 a day, $10 US a day, and the contribution that they make on behalf of their families, they participate also. They participate as a co-financier in their health plan, is about $1 a month. So that's about equivalent to 1% of their monthly income, which for them is affordable. Now, they are what I refer to as the working poor, or the entrepreneurial working poor. They can afford $1 a month. And so this particular business model that I spoke about is okay and relevant to them. There is another population that cannot afford $1 a month. In fact, there are about 40 million such people in our country, at least, that we refer to as the ultra poor, who we know cannot afford that dollar a month contribution, even that much. And so for that particular segment, we know that the government has to, either the government or foundations or social responsibility, there has to be a different approach to catering to the needs of that population. And so to answer your question directly, there isn't a silver bullet or a single approach that can address the needs of all of the entire population. There has to be a textured or layered approach depending on the needs of that particular population segment. In the case of the working or entrepreneurial segment, even if they're informal or formal, a business model is viable, and therefore we have a business model approach. Although it is not certainly a profit maximizer, it is an impact maximizer or value maximizer. I'll speak about that in a minute. Whereas for the ultra poor, certainly our model is not the right model. And that's okay, because it does not have to be a one-size-fits-all approach. It can be modulated or tailored to meet the needs of that particular individual. And that will occur across many, many geographies that we plan to enter into those markets. So there will always be a role for philanthropy. There will always be a role for the government. There will always be a role for, and there will always be a role at the very top of the market for Wall Street cutthroat capitalists as well. We are not a Wall Street cutthroat capitalist by any stretch of the imagination. I certainly don't think of that. And so coming to the concept of profit maximization, I think to Marcus's point earlier, the companies that are more visionary and in which certainly the vast majority of workers are millennials, that is younger companies with people who are 20 or in their early 30s, those employees are pushing those companies to move away from profit maximization and towards value maximization, value for society, and to understand that if they wish to remain a sustainable, viable business over the next century and not vanish, that they need to not just cater to their own bottom line, but they also need to think about the social and environmental impact as an intrinsic, fundamental part of their DNA. It has to be part of their DNA. And that is kind of the philosophy. It's emerging. We're certainly at the leading edge of that movement, but it's certainly emerging. To the gentleman who asked the question about remote delivery of, or rather delivery of services and products in remote areas, I think that technology can play a huge role in that, and it is already playing a huge role in that, in terms of leapfrogging some of the mismatch between human resource accessibility or in-kind resource accessibility and the needs, or the unmet needs of rural or remote populations. And so in our case as well, we leapfrog a lot of these constraints or challenges by connecting urban-based female doctors to community health workers who are last mile, who we have equipped with technology. Telenor, by the way, the Norwegian company, provides the broadband connectivity. They do it as a business, commercially, not as a charity or philanthropy. But they did it because they saw demand. And so if our role is to create that demand or to demonstrate that that demand exists, and their role is then to provide the technology that can connect those communities to our service providers who in almost all cases are urban center based. They live in big cities. They don't want to go out to and live in rural communities, but those rural communities have real healthcare needs. And so this is a bridging, if you will, approach. It's not the best approach, but it's certainly better than what they currently have access to.
Just before another round, there is a fight for the soul of business going on worldwide. To your point, profit maximization or not. And I think the greatest the story, this is actually a true story that played out for everyone to see, was what happened about 3-4 months ago to Unilever, right? I am not here doing, not hired or paid by Unilever to promote Unilever. They just screwed up a week ago with a commercial about Dove and so on and so forth. So not all perfect. But 4 or 5 months ago, Kraft Food, right? The American food, Kraft Foods, went after to buy Unilever. So now you had, and Kraft Food is actually owned by a private equity fund. So it's out of the capital markets and is owned by a private equity funds. who's actually owned by a Brazilian, and I'm from Brazil. So, and they are cutthroat. They are exactly what you described, profit maximization. They will buy, they will shrink, they'll cut every year, they'll cut 30% of cost so the profits can go up and whatever. So they went after and decided to buy Unilever. We all know Unilever is the poster child of the multinational corporation that is trying to do the right thing. Unilever no longer has a CSR department. Unilever no longer has a foundation. Unilever is, if my products and my brands are not social and environmental impactful and profitable, I'll shut it down, that product. There's no more mix of things Unilever. Now, those guys proved that if they get hold of Unilever, they could maximize the profit of Unilever brands by a lot. Despite that, Unilever said no. The board of Unilever said no. The UK and the Dutch governments sent indications, even though they are not shareholders, that they didn't like the idea of Unilever being sold to Crafts. There were petitions over the weekend to protect Unilever because people understand what Unilever means right now. So the Kraft Unilever attempted to buy off is what I call the fight for the soul of business in the 21st century. We need more Unilevers. We need less Crafts. We are all consumers. SDG 12. We are part. We as individuals can implement the SDG on SDG 12. How do we consume? If anything else, get out of here and buy your shampoo from Unilever, not from other companies. So that's a story, and this is, I get very passionate about it because we can't deliver the SDGs without business, but it has to be a different business than the one that broke the world in 2007. Let's not be naive. Who broke the world in 2007 was business, was cutthroat Wall Street business. We don't want that business to be the dominant business of the 21st century, right? And we are in that fight right now.
Indeed, very interesting presentations. The potential for scale is, of course, undeniable, very interesting. But I guess a question to perhaps all of you, the UNDP Center, the Service Center platform, but also the companies, what space do you have in the way that you're operating currently for full range, independent evaluation that's looking not only at intended effects, but also unintended effects? And I think just this example of, that you're providing health insurance to a segment of workers to a company, I mean, healthy workers have a value to that company. And so a possible unintended effect could be that going forward, that company will only hire those people that have somehow had their health provision been privatized. So I'm just wondering if that sort of question, you're also following it up in your different roles as you presented. Thank you.
My question is around actually to Gonka, that is about methodology. We are really interested to introduce these things in Bangladesh as well. You already mentioned that, okay, something is measuring in Bangladesh. But when you are saying that there are some social impact specifically due to the business of private sector, then definitely it comes question around the methodology and who is conducting this evaluation and who is actually demanding for this type of evaluation. It is the companies hired by the companies or from the government or from independent organization, and what is around the methodology, how you are saying that definitely there are some impact due to the activities of, due to the program of private sector. How you can differ that, okay, there are lots of factors actually contributing in the impact and the social impact. How can you measure specifically that this Unilever company is creating this type of social benefit?
And his question was, have you experienced any cases when the government influenced private sector to do more value-driven work through either regulations or policies or just initiatives.
And that's why I said early on, this is a unique panel because there's not an evaluator here. There is, you know, and I'll let my colleagues from the business community to answer the value for them of independent outside evaluators, right? At our center, UNDP, we, as part of UNDP, get outside independent evaluators internally, externally, by donors, you know, more than we can handle. Our niche, our strategic choice, based on years of working with business, was not to set up an external, extrinsic evaluation process, but to set up a approach that is customized to each one of the companies that you heard here, plus many more, you know, and let them embed that into their natural operations, natural dashboard, you know, in that sense. I actually argue that business better at continuously measuring performance than a lot of us in development. In that sense, they have much more rigor in dashboards. That doesn't mean that is in independent outside evaluation that happens. So I'll let them talk about that in a minute. Peace building. We actually run another program together with OCHA, with UN OCHA at my center, called the Connecting Business Initiative, which is entirely dedicated to the role of the private sector in humanitarian action. So I can talk to you offline on that. Easier done on natural disasters, much more complicated on complex emergencies, conflict, and elements like that. But we actually working on that and trying to figure out what is the role that business can have, not only on preventing, but also on responding and recovering to disasters and complex emergencies. In that sense, I'll talk to you off because it's a long conversation. I'm not sure if they have anything to say about that, but if you have, feel free. Do you want to, you know, there's a lot of questions on evaluation. So Thomas, can you do some technical stuff and then you guys can come and go for it.
So this measuring, how can you incentivize companies to measure unintended consequences is a very hard one. We also struggle as the platform that is promoting inclusive businesses. But we do it, I mean, so for our program, what we do, how we create an impact measurement framework really begins with conversations with companies at all levels. So we start the conversation with the management level, who have the strategic vision of how they want to use the data for, but then for all the 21 companies, we go to the field to meet their field officers to understand their priorities for data. We haven't been able to actually extend these consultations to the beneficiaries when we are actually designing the surveys, but this is something that we actually are very interested because you know, having that wider stakeholder consultations hopefully will allow companies to identify some of the impact areas that they haven't really thought about when they wanted to start measuring impact. So that's something that we are thinking of. And about attributions, again, this is extremely challenging questions because we're not, as you all know, conducting a rigorous randomized controlled trials. And because we are working in the context of business where it is hard to control for these variables, we are limited in terms of what we can do and cannot do, but having a rigorous theory of change, results chain, to identify what are the variables that are under a company's control and what are not under, what are external factors, allow us to at least understand what can company actually claims and cannot claim. So we begin with that kind of understanding.
Just so not to forget the gentleman's question in book. So can government incentivize, can government help business move in the direction? Our work at the Istanbul Center, in the last 3 years, we've been working with the G20. And we actually set up a series of policy instruments, which we believe if governments were to adopt those instruments, and we've done that together with the World Bank, as their national policies, you would see more companies like that happening in Ukraine and in other governments. And that goes from access to finance, access to information about consumers, about base of the pyramid market, access to regulatory framework, and access to incentives. As I said, in the Philippines, the Board of Trade and Investment in the Philippines has created a certification process for inclusive business. And when, and which is outside, right? That's an independent certification process. When a company is certified as an inclusive company, i.e. the one that is including the base of the pyramid into their core business, they get an extra tax incentive. That no other company without that certification can access to, right? So there is beginning to see policy instruments, back to the three things that companies care about it, the regulation. There is an important role for government to point to the marketplace what kind of business models you value in Ukraine and you value in any other country. There is no replacement and substitute for that in that sense. You three, you can kind of finish us off, answering all those questions and complement with your final thoughts.
The question is, I think if, as a private sector, if your intention is authentic, if your intention is that you actually want to maximize value, not to make cutthroat profits, then you will actually embrace and welcome independent evaluation. And we do, in fact. So I'm a surgeon. I'm not a behavioral economist. I'm not a statistician. I don't profess to be one. And therefore, I welcome that type of expertise because that's expertise that we lack in-house, A, and B, because it's not our day job, and it is your day job. And so therefore, that type of collaboration actually is really, really, I think, can be very, very impactful.
Let me interrupt you. Will you pay for it?
Yes. Yes, we will. We'll find out a way to finance it, whether we do it ourselves or through partnerships. But yes, absolutely. And there is a significant appetite out there for this type of work because it's understood that, as I said, for the companies that get it, and there are a few companies that do get it and that are at the leading edge of this kind of social transformation, if you will, they will absolutely finance this because they understand the power of independent evaluation, and they understand that the purpose behind that evaluation should be to guide them towards a better place, to refining or honing or improving their service delivery. And for us, we believe we have a lean startup philosophy, which is to continuously improve our service delivery. And if you, as independent evaluators, can help in that process, absolutely bring it on. So that's point A. Point B, so just regarding that, actually, that's one of the reasons why we were very excited by this UNDP partnership when we were invited to join this business call to action. Number two, we recently entered into collaboration with MIT, Massachusetts Institute of Technology. They have a poverty action lab called JPAL. And so we're just in the early phase of discussions with them about doing a randomized control study, because we believe that if there is a way to demonstrate that our intervention works and to do it rigorously, and then that evidence can then be taken to the government or governments, that's very powerful evidence, and it's very useful evidence that we think can, and we don't have to be the service providers, it can be other service providers. But the point being is that type of philosophy that I think, well, that kind of mindset that exists in the private sector as well. It is certainly a generational effect. You will see this happening more and more as the millennials emerge. I'm not a millennial, by the way, but 95% of our company has millennials as employees, and so we listen very carefully to them, to what they have to say, and to what their aspirations are, and they are the consumers of the future too. And so if your consumers are telling you that they don't want you to make something that destroys the environment, then you should bloody well listen to them, I mean, frankly. To this lady who mentioned the peace building point, so the private sector has a tremendous role to play in that, I believe. How? So, as I mentioned, we have a lot of beneficiaries or workers in our supply chains, in private sector supply chains. Many of these people are migrant workers, refugees. In Pakistan's case, they are internally displaced because of either ethnic conflict or because of the war on terror or other reasons, but they have migrated to other areas, and they are looking to reintegrate into society. And private sector can play a huge role in catalyzing or in enabling that by fully integrating them into their supply chains. Socioeconomic opportunity, giving somebody access to socioeconomic opportunity, is the biggest deterrent against conflict and against violence, in my opinion, again. So we believe very strongly that we, as the private sector, have a very, very important role to play in that. And yes, the government can support that by providing incentives, etc., etc.
Now, in this room, you are all expert, but private sector are used of having financial audit. So when they would like to work on social impact area, they are looking for consultancy as well. But in general, in Turkey, we created demand for social impact measurement. People understand now they need to measure, but there's a lack of supply side. So on the pipeline. So we lack of consultancy companies, good consultancy companies, quality consulting companies, experts, evaluation and impact measurement experts in the field. So as a university, our responsibility is we are trying to open master degree programs, for instance for impact evaluation programs. And also as my unit, we work a lot with existing program evaluators, how they can, support NGOs or companies from shifting output level to outcome level. This is a very important mindset. I mean, again, I am saying that you are expert, but companies or other stakeholders, in order to be ready to work with you, they have to, progress to work with you. In that gap, we are there to support, in strategic way. And support them developing their theory of change, explaining them, working with them, social impact means that as a result of a project and activity that we create on people's life, change that on people's life, and the social impact could be, not always positive, but they might create a very bad negative impact, unintended, intended, long-term, short-term. They are really not aware of that. They are just, finishing their projects or programs, and then they are coming us, can you measure that? So this gap is very important, that we should work on it. And in Turkey, I see two types of companies. One type of companies they want to measure their social impact because there are social pressure on them to protect their brand perception. So they look for consultancy for social impact management. And the other type of company, they are doing, for instance, 4 years of CSR, and they are very successful. They have very successful project, and they understood the value of the impact of social value that they are creating through these projects into their core businesses. So they want to manage better their social impact. Again, they are looking for consultancy. But in Turkey, as I told, supply side is a little bit lagging behind. Thank you.
So I will actually agree with both of you. And I would like to second Asher when he says that the intent has to be good, and for a company like us, since the intent is there, yes, we are willing to have partners on board for an independent evaluation as well. And we would definitely, because see, ours is a very long-term sort of plan to be able to take this program to all the affected emerging markets. And for us to be able to do that, because our intent is clear, yes, we would be happy to do that as well, and sort of take care of all the negative, impact that sort of is a part of the model as well. So that's an important piece, yes. Second, I think I would like to answer your question, sir. So I think it hasn't happened with our model yet. I don't think we are there yet, but I think I see, I definitely see it happening in future, because we sort of bring in the technology, And once we have the technology, I think it becomes easier for private sector to work with the public sector through what we all know is basically public-private partnerships. And I think that's the way forward for us as well, to be able to reach where we intend to reach millions of people. Thank you.
So, does anybody know, in the goals, in the 17 goals, in the 169 targets, in that, not in the text of the Agenda 2030, which is much larger, just in the text of the 17 goals and 169 targets, how many times the word private sector appear? Once. Only once. And it's 12.6. And it's all about, no, only once. On the goals, he's saying 8 times. You and I have to come and you have to show me the others because I miss it. Yeah. So the 12.6 is the only target dedicated to private sector. And it's about reporting. And it's about asking governments to put in place the policies for non-financial reporting to take place at the same level of importance of financial reporting. If that is to happen, then this whole conversation and the role of external evaluation will completely change. Help me thank our guests, and thank you very much.